So, all right. So this is a 2-day adventure. Like I said, this is mostly anatomy day. So both the gross anatomy and the microanatomy, and then we're going to crack into urine formation, and I'm going to spend a whole lot of time on the front end, and then we'll finish making urine and analyze it on Monday. So the kidneys and the liver are very busy organs. The kidney's main function is to filter the blood, and in doing so is going to remove metabolic waste. These are wastes that we create that contain nitrogen. While it's doing that, though, it's also responsible for our electrolyte balance. Your electrolytes you get from your diet, and we lose some, and so this has to be regulated based on body needs, and so they're responsible for that. They're going to work with the respiratory system in regulating our pH. We like to be at 7.4, 7.35 to 7.45 is considered homeostasis. Oh, we're still back to this. They also control blood volume, and we know that blood volume determines blood pressure. So greater volume, greater blood pressure, lower volume, lower blood pressure. And so now we are going to learn the nitty-gritty of it. We watched the video in Unit 2, the one that was animated, and the person got stabbed, if you remember that one. So the kidneys require a certain amount of pressure to do their job. When there is not enough pressure, they release renin. We get renin, angiotensin, aldosterone, ADH release, and that restores blood volume. So we are going to learn all about that. Another little side caveat that it does, it also performs the final step in activating vitamin D. You probably have connected vitamin D with your bones. You've learned that in AP1. And we get vitamin D, yes, from our diet, but also from the sun. And from the sun, the liver is involved, and then the kidneys are involved. So we get our vitamin D from there. And vitamin D, what we need it for is activating it to become a hormone calcitriol that is going to allow us to absorb calcium from our diet. So that's why those two things go together. And then in Unit 1, we learned about erythropoietin, which causes red blood cell production, and they also are responsible for that. So they are a very hard-working organ. So when the kidneys fail, either acutely or chronically, there is a list of symptoms that you're going to see based on those functions not getting done, okay? Just go erythropoietin, because we said red blood cells carry what? We just talked about respiratory. Oxygen, yes, and hemoglobin. So if we don't have enough of those, someone's obviously going to be lacking energy, so weakness, lethargy, and they can't carry oxygen, so you're going to get shortness of breath. Fatigue is going to be down here. And then they're also responsible for fluid balance, right? So we lose or get rid of our excess fluids through urination. So if they're not there to do that, so there's going to be edema, so widespread swelling, anemia because you don't have those red blood cells. They're responsible for acid-base balance. And chronic kidney disease has an effect on the heart as well. So you're going to have heart arrhythmias. And because their job is to remove urea, that's why it's called urine and urea, there's going to be high levels in the blood because that's not going to be getting done. And someone's just overall not going to feel well, lack of appetite, and then excess urination because lots of times there's going to be holes in our filter, so loss of excess fluids. Or you can have it the other way, no fluids being produced, so total kidney failure. Busy organ. All right.
If your kidneys fail, is that likely to result in fatality?
Yes.
Oh, wow.
Yes, because of all those things aren't happening, but the nitrogen waste building up in the blood is toxic. So the number one thing we're getting rid of in urine is urea, and urea is basically this amino group. Our body is great with carbon-carbon bonds and oxygen-hydrogen. We've got things to do with that. But typically when you see amino groups and nitrogen, those are our wastes. So if we cleave off this amino group, we have ammonia, and then we have our respiratory gas, which is our gaseous waste. They combine to form urea. And so that's another way we get rid of our waste is through urination. So most abundant in urine is urea. Also, we eat other cells, so we eat their DNA and their RNA. We break down their nucleic acids, and there's nitrogen there, so we get uric acid. So that's another one of our nitrogen-containing wastes. And perhaps you remember from skeletal muscle where we have creatine, and creatine serves as that short-term energy burst when muscles are called into action. A breakdown product of that is creatinine, and this is also excreted in the urine. So these are our wastes that need to be excreted. The lungs are a secondary excretory organ, if you want to think about that, because they are working together with urinary to maintain acid-base balance. So we get rid of our carbon dioxide, that's our waste gas. And through sweat, you also lose some urea. So through sweating, and we lose some of our excess ions that way in sweat. All right, which came first, the kidney or the kidney bean?
The kidney.
Yeah, the kidney. We've been around longer. But kidney beans came in 1540, in case you wanted to know. All right, so they're kidney bean-shaped or they're bean-shaped organs, however you want to think about it. They are roughly the size of a dollar bill. Okay, so 5 by 2.5 inches by 1 inch thick. Obviously, people will have different size kidneys based on their size. And you can kind of see from this picture, they are going to be in the abdominal pelvic cavity. They start around the last thoracic vertebrae and then to the lumbar 3. There's my picture. You kind of notice this, this is looking from the back. So the right kidney is lower. So over on the right-hand side of the body, that's where the liver is. And so it's a little bit lower than the one on the left. So roughly not quite an inch lower. The kidneys are also retroperitoneal. So looking at this picture, this is the spine, so this is the front. And the abdominal organs are covered by the peritoneum. You remember learning about your serous membranes. So the kidneys are behind that. Serous membranes, remember, are for organs to move in a friction-free environment, and kidneys don't move. So they don't really need to be in one, so they are attached to the posterior body wall. And they have 3 protective layers around them. So what's going to attach them, this outer layer, if you want to think about it, is the renal fascia. And I always think of renal fascia as sort of like duct tape at the body. You know, like, okay, we need to make sure this stays in place. And so it's a sheet of dense connective tissue that's going to keep those kidneys attached to the posterior body wall. Also encased in that, though, you see we've got our adrenal glands. Like I said, they're not really attached, but that's where you find them, superior to the kidneys. And then we have a lot of fat associated with the kidneys. And so you see all of this fat around the kidneys, and that's called perirenal fat or renal fat pad. And that's to cushion the kidneys. So the kidneys are not protected by bone. And so that's to cushion and protect them. And on the kidney themselves is a fibrous capsule. So when you do your kidney dissection, you may be able to peel off that fibrous capsule. And it looks like the skin of a bean. Just saying, a lot of bean things. So the fibrous capsule is going to give that organ shape and support. It is really the fat that keeps them in position. Like, yes, you have the renal fascia and you have that perirenal fat, but if somebody loses that fat, then the kidneys can sink down. And so that's called nephrotosis. And you can kind of see in this picture, the kidneys are supposed to be, up here, and the person, this patient has lost their renal fat. This can be because of emaciation, anorexia, or just rapid weight loss. It also just happens sometimes randomly with age. Okay, so sometimes there isn't like a cause necessarily. And what can happen then, so if you think if this kidney drops down, the kidneys are making urine, and the urine flows down the ureters and is stored in the bladder. So if this kidney falls, there's a kink in the ureter, and the kidneys continue to make urine, and so urine backs up into the kidney. So hydronephrosis, the kidney starts to swell, and that's going to basically poison the kidney. All right, so let's start coloring. So gross anatomy, compared to the respiratory system, there's hardly anything there. Did you have a question, Lauren?
What was that word in front of anorexia?
Oh, emaciation, just weight loss. If someone's emaciated, they have no fat on them. And it could be due to disease, like cachexia, like that wasting with cancer or end-stage disease. All right. So the kidneys, like I said, they are responsible for filtering blood and making urine. They are made up of tiny filtration units called nephrons, which we have to learn all about nephrons. You'll know more than you ever wanted to know about a nephron by the end of these 2 days. So when I ask you in a couple weeks, what's the functional unit of the kidney, you're going to say nephrons. They are solely responsible for filtering blood and making urine. So there's 2 of them. They are attached to the posterior body wall. The liver is over there on the right side. So the right kidney is roughly about 1 inch to 1.5 inches lower. It's going to depend on someone's size, but it's going to be lower because it has to accommodate room for the liver. And then there is the left. Do be mindful of anatomical left and right. Not everyone has that down. It is not your left and right, but your patient's left and right. Or the specimen or picture in this case. So the kidneys, they filter blood, they make urine, and then they are going to be collected and be exported out of the kidney and travel through these smooth muscle tubes called ureters. And so ureters are responsible for carrying urine from the kidneys to the bladder. They are smooth muscle tubes, and they are going to have wave-like contractions that move the urine into the bladder. They run behind the bladder, and then they have 2 openings on the inferior aspect of the bladder or the bottom of the bladder. And they're smooth muscle. They're going to move by peristalsis, so it's just not a gravity thing. It's not like you have to stand up for the urine to flow down to the bladder. The bladder is basically a muscular sac. The muscle that makes up the wall of the bladder is called the detrusor muscle. Okay, so the 2 little yellow dots are the openings to the ureters. Leave this triangle, don't color that. And the bladder is going to have folds called rugae, and so that will accommodate the stretch when the bladder is full. When the bladder gets sufficiently full, then there is what's called a micturition reflex. So that fancy word micturition just means urination, and the bladder will be involved in voiding, so emptying. And we'll hit that in the second part of this lecture. There is an area of the bladder that's on the inferior of the organ. And you can see that there's 2 openings to the ureters, and then this is the opening to the urethra, which is going to carry the urine outside. And so it makes a little triangle, and so they call this the trigone. What's significant about this area is it doesn't have rugae, so it doesn't stretch, and it's more attached. But also because it's close to the openings, if there is a bladder infection, okay, so it's called cystitis, then it's probably going to persist in that area. Just because that's where all the openings are, that's where the bacteria can enter. And then 2, notice that the ureters, the openings are also there on the inferior aspect of the bladder. So a urinary tract infection can start in the bladder, and then it can work its way up the ureters, and then it can even infect the kidneys, so if it spreads. And then the exit tube or portal is the urethra. We are going to have some sexual divergence. The urethra is not the same in males and females, so variable. So urethra has one function in females and is part of the reproductive system in males, as well as being part of the urinary system. So anatomically, that's not so bad, is it? All right, so now we are going to do the bottom part, and that is the internal anatomy. So each kidney, remember there's 3 layers. We have the renal fascia that attaches it to the posterior body wall. It's going to be encased in renal fat or perirenal fat, a renal fat pad. And then on the kidney itself is going to be a capsule. And this is going to be fibrous connective tissue that's going to give that kidney shape and support, and then also containment to the kidney. And when you dissect your kidney, you can probably peel this off, either using a probe or forceps. So when you dissect your kidneys, you're going to do a frontal section. So cut it front and back. And when you look at it visually, you're going to kind of see that there's two layers to it. There's this outer layer right here. So drawing a line, dashed line across the base of those triangles or pyramids. And the outer part of any organ is going to be the cortex. Since we're talking about kidneys, it's going to be the renal cortex. The word renal always refers to kidneys, whether it's a word of a disease, a treatment, a drug. If you hear renal, it has to do with the kidneys. What is going to be out in that cortex? That is where the nephrons are located, our little filter units that are filtering and making the urine. They're going to be out in the cortex. So when you look at it, it just kind of depends on the specimen that you get, but it tends to look like it's spotted or it looks grainy, okay, because like I said, the nephrons are going to have a glomerulus, which is round, or glomerular capsule. And so if we have a cortex out here, the middle part, so what's inside, is going to be the renal medulla. So the renal medulla is going to make up that inner region. And you can see in the inside we have the pyramids, and then we have something else which are going to be called the renal columns. So the medulla is the inner region. And so for our drawing purposes, if you will draw a line right there just at the tips of those pyramids, kind of make it look like candy corn. It's right there. And then each one of these is a renal pyramid. And they are striated in appearance, so they're striped in appearance. And that is because they're going to be a cone-shaped collection of collecting ducts. So if you want to imagine this, take a fistful of straws and hold them just at one end and allow them to splay out. So almost like if you were holding a bouquet of flowers and holding it at the stem. So these are cone-shaped. They are striated because they are a collection of parallel urine collecting ducts. The urine is made out here in the cortex by the nephrons, and then urine is going to flow through the ducts in the renal pyramid, but each one of these is a pyramid. And then the little tip of the renal pyramids is the renal papilla. And that word papilla means nipple. So those are the kidney nipples. The urine is going to drain from the renal papilla and then be collected in a sort of cup-shaped passageway called a minor calyx. So this is all urine flow. So urine is made in the cortex by the nephrons. It's going to flow through the collecting ducts in the renal pyramids, and then there's openings in the renal papilla, and then urine is going to flow into our next structure, which is the minor calyx. So before we get to urine flow and the calyces and the renal pelvis, notice we've got these spaces in between each of the pyramids. And so those spaces are called renal columns. Like I said, you don't have to color all of them. You can color them later. So the space in between the pyramids, each one of those is called a renal column. When you're coloring these, if you could leave a little space here as well. So like notice I didn't go all the way to the tip because the kidney is going to be packed with fat. When you go to dissect your kidney, you're going to be digging out a lot of fat if you want to see something. So any open space in the kidney is filled with fat. If you kind of want to think about it, because I'm always like a very imagery, physical person. So all these little fingers, imagine this sort of like electric socket or like a plug that's going into a socket. And I don't know if you've ever had like a house or apartment that the plug didn't quite fit, like it was loose and it would fall out of the wall. Okay, we didn't want that to happen, so they plugged those spaces with fat. All right, so each one of those is a renal column. What's in the columns, these are passageways for vessels, so it's not urine collection, so we're going to be filtering blood, so there's going to be blood vessels taking blood to the cortex to be filtered by the nephrons, and then the blood's going to be cleaned, and then the blood's going to return through renal vessels that are ultimately going to drain into the renal vein. So these passageways, the renal columns, are passageways for vessels going from the cortex to the medulla. All right. So when you read about the kidney, they say that the kidney is divided up into lobes. And a lobe is made up of, let's see, there we go, so up here, the pyramid and the column tissue surrounding it. Okay, so wherever there's a pyramid and everything around it is going to make up a lobe of a kidney. As far as number of lobes, I read all different numbers, so 12 to 18, something like that. No textbook ever locks that down. So lobes is just a pyramid and the surrounding column tissue makes up a lobe. All right, so go ahead and draw lines. So right here, here, and here. So it has some divisions. Draw lines just across the ends of all of those. All right. So remember, we've got our renal cortex. The nephrons are there, filtering blood, making urine. The urine is going to flow through the collecting ducts that go through the renal pyramids. That's why they appear striated. The urine is going to flow out the renal papilla, or the kidney nipples, if you will, and then they're going to flow into this space. And those spaces off of a renal papilla or renal pyramid is called a minor calyx. That's singular. So one is a calyx, plural is calyces, and a minor calyx is collecting the urine from one lobe, so off of one pyramid. So each lobe of a kidney is going to have a minor calyx. So there's one here, there's one, yep, they all get one. So this is just a smoothed out funnel area, cup, I think is what they often describe it as cup shaped, like it's going to collect the urine from each of the pyramids or from each lobe. So draw a line right here. There are some places in the kidney where just because of the shape, it's bean shaped, because of the shape of the kidney, some minor calyces will flow into the same space. Like a few of them will flow into the same space. And when minor calyces connect and there's a space, that is called a major calyx. So here's a major calyx. Notice there isn't a major calyx over here that you can see in this picture. So minor calyx or minor calyces all flow in the same space. Before we get to this space, then it's called a major calyx. So where minor calyces fuse together. And once again, we're just transporting urine at this point. It's already been made. Just moving urine. And then this funnel-shaped part, so once it becomes a tube, like just kind of draw a line. This is called the renal pelvis, and it is going to collect all of the urine from that kidney. So all the urine from all the minor calyces, from the major calyces, is all going to flow into this sort of funnel shape, bowl shape. And then the urine is going to flow into our next structure, which is the tubes, which are the ureters. And so there's always going to be mucosa, submucosa muscularis. So this is going to be, the urine is being moved by smooth muscle peristalsis. And then that last part is the ureters. So urine's made out here in the cortex by nephrons, flows through the collecting ducts and tubules, and then it's going to drain out of the renal papilla into a minor calyx, then a major calyx, then the renal pelvis, and then the ureters, and then it's going to be stored in the bladder. And then the only thing we have left in this picture are those open spaces. And spaces in the body are called sinuses. Doesn't mean they're empty, it just means it's a space. And these are going to be filled with fat. So right here, that place we left empty where the columns are. And this is just where the ductwork connects, is where there's going to be fat. And like I said, when you dissect your kidney, you're going to be digging out a lot of fat. So fat inside the kidney. So they fill up the spaces called the renal sinuses. All right, make sure your name is on your paper. Take a picture of it, convert it to a PDF, and upload it to the Dropbox.